So since all the panelists are here, so I'll take that opportunity and request Dr. Faisal to please share his clinical perspective on the panel topic. Dr. Faisal.
I figured out how to turn the mic on. So I'm not going to say much to save time because I also don't want to be the person holding up people from T. But just that to answer one question before that, why are we only talking about hepatitis and not the others? So you just want to emphasize that all of the other co-infections are important. We're talking about viral infections and co-infections, but the thing is, this is a very low-hanging fruit. Both infections go together, HIV, Hep B, and HCV. And as you saw, there's a lot of co-infection between HIV and Hep C, at least in the people who inject drugs, but also in the non-pivots as well. The other thing is, we should also not forget about other co-infections. So I just want to plug them in very quickly. TB is one. And TB is a little bit of a double-edged sword here because I also know that same-day treatment is not started because of the fear of paradoxic reaction, and treatment is delayed until TB is ruled out when clearly there is often no TB. And the other co-infection we should never forget about is our STIs, and they also link with viral infections because HPV is extremely common, especially in the MSM population, which is also another viral infection. So, but coming back to HCV and HIV, there are two places to integrate this. The first is in the HIV clinic, and hence checking for Hep B, HIV, HCV, for all new clients is extremely crucial. And then integrating care. So the way Dr. Saeed Hamid mentioned it looked really simple. Even I can treat Hep C the way he mentioned it. So maybe putting that in treatment for HIV clients. And the second is at PrEP. So you may know that in the new PrEP SOPs, HCV and HBV testing both are included. So Hep B was included initially, but we've also now included HCV as well. Again, you don't want to miss any opportunities to test and diagnose. So I'm going to end here to get other people a chance to talk.
Thank you, Dr. Faisal, for being so succinct at this point of time. Before you, ma'am, I would request my colleague, Ms. Safia, to share her perspective, community perspective on the topic. She'll be speaking in Urdu and my colleague will be translating that in English. Ji, Ms. Safia.
अस्सलाम वालेकुम, मेरा नाम सफ़िया है और शेखपुरा से आई हूँ। मेरे साथ मेरे शोहर शहजाद हैं। हम उन तमाम लोगों के शुक्रगुजार हैं जिन्होंने हमें यहाँ मदऊ किया और मौका दिया कि हम यहाँ HIV और हेपेटाइटिस C के साथ ज़िंदगी गुजारने वाले जोड़ों की नुमाइंदगी कर सकें और इनकी ज़िंदगी से जुड़े तजुर्बात और मुश्किलात का इजहार ख्याल कर सकें।
Assalamu alaikum. My name is Safi and I'm with my husband Shahzad from Sheikhupura. We are grateful to all those who have invited us here and given us the opportunity to represent those living with HIV and hepatitis C and to share their experiences and challenges. We can express our thoughts and feelings about the difficulties and problems that come with living with these diseases.
टीके के ज़रिए नशा करने की वजह से मेरे शोहर HIV और हेपेटाइटिस C में मुतबला हुए। जो लोग नशा करते हैं और HIV पॉजिटिव हो जाएं तो इर्द गिर्द के लोग इनके साथ इम्तियाजी रवैया रखते हैं और माशरा भी इन्हें कबूल नहीं करता। मुझे भी मेरे घर वालों ने कहा कि इसको छोड़ दो, लेकिन मैंने इसकी सेहत का ख्याल रखा और साथ साथ अपनी बीमारी को भी कबूल किया। इस बात का फ़ैसला किया कि मैं इसके साथ रहूंगी और इस वायरस की वजह से अकेले नहीं छोड़ूंगी और हम एक दूसरे का सहारा बनेंगे। लोगों और मुआशरे की बातों की परवाह किए बगैर मैंने अपने शोहर की और अपनी ARV की बाकायदगी का ख्याल रखा ताकि हम सेहतमंद ज़िंदगी गुजार सकें और हमारे ख़ानदान की जिम्मेदारियां उठा सकें।
Due to drug addiction, my husband contracted HIV and hepatitis, and people who test positive for HIV are often discriminated by society and rejected by their families. My family also told me to leave him, but I took care of his health, also accepted my illness and decided to stay with him despite the virus and not abandon him. I ignored what people and society said and ensured we both received regular ART treatment so that we could live a healthy life and he could fulfill his responsibilities.
हमारे जैसे बहुत से शादीशुदा जोड़े गुर्बत, मुफलसी और नशा करने के बाद होने वाले हालात की वजह से अपने सेहत के मामलात को तवज्जो नहीं दे पाते, मगर नई ज़िंदगी का स्टाफ और घरों में जाकर हम तमाम सहूलियात की फ्राहमी को यकीनी बनाना हमारे लिए एक नेमत से कम नहीं है। हमने और हमारे जैसे बहुत से जोड़ों ने इन तमाम वसाइल से फ़ायदा उठाते हुए नई ज़िंदगी से पहले HIV का इलाज शुरू करवाया और कुछ अरसे बाद हेपेटाइटिस C का इलाज नई ज़िंदगी और आगा खां की मदद से मुकम्मल किया।
There are many couples like us who, due to poverty, helplessness, and drug addiction, cannot pay attention to their health issues. But the staff of Nai Zindagi, by providing all these facilities in our homes, has made it possible for us to access healthcare, which is now less than a blessing for us. We and many others like us have benefited from these resources and started treatment for HIV and hepatitis C with the help of Nai Zindagi and Aga Khan.
पाकिस्तान में हेपेटाइटिस C और HIV को अक्सर खामोशी और बदनामी का सामना करना पड़ता है, जिसमें मुतासरा अफराद के लिए मदद हासिल करना मुश्किल हो जाता है। एक कम्युनिटी के तौर पर हमें इन तमाम रुकावटों को तोड़ने और अपने प्यारों की हिमायत करने के लिए इकट्ठा होने का मौका दिया। नई ज़िंदगी और आगा खां की प्लेटफार्म से हमें सेहतमंद लोगों की तरह मस्बत ज़िंदगी गुजारने की हिम्मत मिली।
In Pakistan, hepatitis C and HIV often face silence and stigma, making it difficult for affected individuals to access help. As a community, we have been given the opportunity to break down these barriers and support our loved ones. Nai Zindagi and Aga Khan's platform has given us the courage to live a positive life like healthy people.
मेरी दरख्वास्त है कि सरकारी सतह पर HIV और इससे जुड़े अफेक्शन की सहूलियात को यकीनी बनाया जाए ताकि मुतासर कम्युनिटी भी सेहत के वसाइल बेहतर तरीके से हल कर सके।
My request is that at the government level, facilities for HIV and related infections should be ensured so that the affected community can also access health resources more effectively.
हम नई ज़िंदगी के शुक्रगुजार हैं कि इस बात की आगाही दी कि दूसरे लोगों को इससे कैसे बचाया जा सकता है और सेहत के बराबरी के वसाइल देकर हमें सेहतमंद ज़िंदगी गुजारने का मौका दिया। ये आप पढ़ें तो।
We are grateful to Nai Zindagi for raising awareness about how to prevent the spread of HIV and providing us with equal access to health resources, giving us the opportunity to live a healthy life.
Thank you.
Basically, Safia and Shahzad both are concordant for HIV as well as Hep C. They have completed their Hep C treatment and are adherent to ARVs. Shahzad want to say something?
अस्सलाम वालेकुम। हम नई ज़िंदगी का शुक्रिया अदा करते हैं कि इन्होंने हमें अच्छी और सेहतमंद ज़िंदगी गुजारने का मौका दिया और हमें साथ ये भी आगाही दी कि इससे दूसरे लोगों को कैसे बचाना है। और आखिर में ये मैं दरख्वास्त करता हूँ कि हमारा हेपेटाइटिस B का भी इलाज शुरू किया जाए, वो भी हमारे लिए कारआमद साबित होगा। शुक्रिया।
We are grateful to Nai Zindagi for raising awareness about how to prevent the spread of HIV and providing us with equal access to health resources, giving us the opportunity to live a healthy life. Finally, I request that more resources be added for the research and treatment of hepatitis B, which would be beneficial for us as well. Thank you.
Thank you, everyone. So now I would like to move on to Dr. Atif to share WHO and international perspective on the topic of the panel discussion. Please, sir.
Thank you, sir. Regarding the topic, sir, WHO is very much supporting and dedicated for the implementation of integrated health services, especially the essential health services package, which is endorsed by WHO. And we have done the pilot in Charsadda and ICT, and we have got very good results there. And now we are going to implement again another pilot to Ladkana, and hopefully we are going to implement in the whole province and then the country, inshallah.
Sure. Thank you, Dr. Atif. So last but not least, Dr. Anita, to please share your perspective, international perspective and experience on this integration. Please.
Thank you, Mr. Moderator. I think we have learned here from the couple here that a person can have multiple disease, HIV plus hepatitis B plus C, probably also, in other cases, they may also have syphilis, for example, and TB, right? Now, this is where the hassle comes, where, when one disease is being treated different places or different center. So one person being treated for HIV in clinic A, for example, and then detected hepatitis B, hepatitis or viral hepatitis, you have to refer them to a different clinic. And then you have TB, you have to refer them to another clinic. So this is where the issues are, where while referring to one center to another center, you may lose this patient. They may go, they just go default, things like that. So looking at the managing or eliminating disease, communicable disease, not only HIV, but also viral hepatitis, but also ending TB and other STI, for example, wouldn't it be good if patients they just go to one center and get tested everything for all those diseases that is relevant for them and get treated under the same roof. So this is to ensure that they get full treatment without losing them in between when we refer them to different centers. So this is where I think way forward, a path for Pakistan towards eliminating multiple diseases, not limiting to viral. The way to go is to full integration of primary care. So definitely this is something big, something huge that requires 3 Ps, right? Political support, workable policy, and participation. So this is where even we have a beautiful integrated clinic, right? You name it, you got every test there. But if the client or the community don't use it, don't utilize the service, no point. So this is where the 3rd P, which is participation, plays important role, where the participation of community, together with the provider, okay, that would bring in clients and patients to our healthcare or health clinics or primary care clinics. So that is my last message, right?
Thank you, Dr. Anita. So in the interest of time, we'll move on to question and answer session. If you have any questions, please go ahead. First introduce yourself, your name, organization, and then ask the question. Sir.
I am Dr. Sharaf Ali Shah from Bridge Consulting Foundation. My question is Dr. Faisal. HIV and syphilis co-infection quite common, and especially in people living with HIV/AIDS. We have just concluded one study to look at this co-infection, syphilis and HIV in transgender population and female sex workers in 5 major cities of Sindh. So my question is that how often you see neurosyphilis cases among HIV positive people, because neurosyphilis is possible in primary, secondary and tertiary syphilis.
So thank you. No, so yes, I completely agree that syphilis is actually very common, probably even more common than HIV is in the general population, and in the HIV population, it's obviously common, and it's often not screened for at most centers. So I know at least in Sindh, one center has the combined kit that they're using for, but most centers don't screen for syphilis. As far as neurosyphilis is concerned, I think it is a very frequently misdiagnosis. We do see strokes coming in at younger ages over here, and syphilis is often not detected. I have a couple of people who are elderly with dementia, and it turned out to be neurosyphilis. So it's a misdiagnosis because it's not, syphilis is the great mimicker. So it is often it is missed. I have not seen a lot of neurosyphilis in my HIV patients, but I have seen ocular syphilis, which is treated just like neurosyphilis as well. The other issue with syphilis to keep in mind is that availability of penicillin is very limited, very difficult to get penicillin, both IM and IV. So we may be stuck with second-line treatment like ceftriaxone, doxycycline, which we know is not, maybe not as efficacious.
Any question? So I think then I'd like to request our co-chair, Dr. Yasir Hayat, to just conclude the session. Please, sir.
Ji, Bismillahirrahmanirrahim. I'm thankful to all the panelists, especially I'm thankful to IAS, Nayi Zindagi and the Aga Khan University on behalf of the integrated program of HIV, hepatitis and thalassemia KP, Khyber Pakhtunkhwa. This is, they provide us an important platform for the all the most skilled mind, I would say, in the HIV community. To name a few, I would name Dr. Khalid, KD Saab is sitting there, Dr. Umar is sitting there, Dr. Faisal is sitting there, all of them, and of course Salman Saab. So they provide us with what you would call brilliant mind. They come together for the prevention of HIV and regarding these strategies. I would also like to thank you, Dr. Anita Suleiman, for providing us insight into the primary health care model of the your government. So it was very fruitful for us regarding policy making and rest of the session. It was hope it goes well tomorrow as well, and we could come up with other strategies and some plan for the future for the PLHIV communities. Thank you.